Welcome to Module 1, the key tenets of public health. I'm excited about the journey we're about ready to go on, and for some reasons that you may not completely understand now, but what I want you guys to do is more than just learn about the how the public health works, but also learn how it can help you impact others for the good. Let me tell you a quick story about when I was just graduated from college. I had someone talk to me about the importance of compound interest. And what it was at that time, it was in regards to money, right? If I made a dime on a dollar, then now I had $1.10 that was working for me with my money, right? And that continued to compound. And some have called it the eighth wonder of the world, right? Um, but the same thing applies to our health. And let me tell you what I mean by that is that um, number one, if I can help some of you get into that field, even if you don't get into the public health field, you get into medicine, you get into ministry, whatever it is, you'll be able to take some of the concepts that we learn here in this class and apply them into other day life, just like I was able to apply the compound interest to public health. And again, I'll tell you what I mean by that. So um, in my intro, I given you two examples of where I had worked with the young kids at the NJB, the National Junior Basketball Association. I went into that just because my kids were playing basketball, but as I got more involved in it, it became more of a mission for me in that we, again, we learned that a lot of kids would drop out because they weren't good enough for this particular league or what have you. So we just said, listen, all can come. And we said that because we understood that exercise had a profound impact on not just their brains, but on their whole physical abilities. So, over my 15 years there, we probably impacted about 7,500 kids. So fast forward to this last February. Again, I have a background in public health. I've worked more on the managed care side, hospitals, that sort of thing. But when we were told that our kids couldn't go back to sports here in California in February until it got to a particular level, which was one infection, COVID infection per 100,000 people, we again, I put my thinking cap on and I said, listen, let's do a risk analysis here. That's never going to happen. Number one, I mean, we're talking about an infectious disease, and two, kids are not vulnerable. So I used my public health risk assessment things, and I said, listen, I'm going to push back on this, and we're going to try to get these kids back to playing sports. Why? Because their brains are going to develop better. They're going to be more healthy. They're going to have more community. All of these things were in my mind, things I'd learned through the public health spectrum. So what did we do? We took it to the state of California and we filed a lawsuit. We filed it under the 14th Amendment, which said there's equal protections under the law. NCAA was playing, the NBA was playing, other sports were playing. And so why am I telling this story? Because at the end of the day, rather than those kids sitting at home, there's about 900,000 athletes, high school athletes in California. So that number, we were able to, through just a public health mindset, we were able to help 800,000 people. So again, compound interest, right? That helps us do those things. So what are we going to look at today? Today we're going to look at just the general framework of public health, and there's some items that I identify as key concepts. And this doesn't mean that the other information that you get here that you'll learn through just presentation and that sort of thing are not important, but these are the things that you have to grasp if you want to be very effective in the public health world. So we'll address a couple of those today. What you'll also see is that we're going to cover, just in brief, some of the six functions of public health, I'm sorry, the six disciplines of public health today. What you'll find out or what we're going to do is we're going to take each of those individually in weeks 2 through 8, and we're going to go into more detail on those. So we'll just touch on them today, excuse me, and then we'll talk a little bit today about the politics in public health and also a little bit about prevention. So let's get started. So what is public health? I mean, this is a common definition that still applies today from Charles Winslow. And he coined this in the 1920s. He said, public health is the science and the art of preventing disease, prolonging life, and promoting physical health and efficiency through organized community efforts. See some other, and here's just a longer definition that he got. There's also one from the Institute of Medicine, which says, it's fulfillment of society's interest in ensuring conditions in which people can, be healthy, and also is organized community efforts aimed at the prevention of disease and the promotion of good health. Now, here's one thing that I would suggest is that we are getting so advanced in what we can do and what we can understand. I mean, for example, the Human Genome Project will be a game changer, already is a game changer in understanding how the bacterial diseases spread. It talks more about tendencies of people. So as technology grows, we're going to get better and better at that. And so it won't be just promoting, good health. It'll be trying to maximize health, I believe, in the next decade or so. So again, another similar definition, but public health looks at the determinants of health, which act at the level of populations in a community. Then it tries to influence those determinants as to impact in a positive way community health. I love the word thrive. The reason I love it is because it's beyond just living, right? It's, how can we prosper? How can we help people flourish? Not just exist, how can we help people prosper and flourish? There's a couple of videos that are listed here that would be part of your module, that you'll look at. There's some great information in there. They do a great job of explaining, some key things, like, for example, what epidemiology is, what public health is, how it's different than standard medicine. So you get an opportunity to look at those as you go through these modules. Now, here are the three core functions of public health are assessment, policy development, and assurance. You'll see these subcategories that are listed here. You're going to see these, but they're all going to be, you're going to see these stated in a little different way from different people. But at the end of the day, they're all the same thing, right? They're all heading towards the same goal, which is to promote and, trying to help people thrive. So again, here's another visual of that. You can see that there's a little bit more detail here. Some people like the pictures better than they like the other stuff, but it's about problem solving on the front end for sure, and it's about implementation and execution on the backside. So again, another way to look at it, repetition here. I'm just trying to give you all sorts of good ways to look at it. We're going to define the problem. We're going to identify risk factors, and you can read through the rest. So here's my visual for you that really I think is a key concept. So we're going to ask ourselves questions, right? That's the best way we learn. Is be curious, ask questions. So what's the problem, right? We have to define the problem first before we can address it. If we don't know what the problem is, how do we address it? And we have to identify what's the cause. Now, one thing that we'll talk a lot about is that there's very few absolutes in science, right? So we're going to try to work with statistics and look at probabilities and try to understand, what is the likely outcome if someone eats, let's say, pizza for 100 straight years, right? What's the likely outcome for something like that? And also what works for whom? And this is important, especially now that we're getting more information on genetics, where I might be somebody that's susceptible or more susceptible. Now, I like the phrase that DNA loads the gun, but lifestyle pulls the trigger, right? So I might be more susceptible, and someone might need a different plan that has a different DNA than I have, or has had a different early life experience than I've had. They may need something different, but for the most part, we need to figure out what works for whom. And the final thing is, how do we do it, right? How do we execute to reach as many people as we can? Again, it wasn't me alone, but through some of my efforts and a bunch of other people, we were able to reach 800,000 students, right? That are athletes in California, actually over 900,000. So this is a good visual to have. I think I put this in your module too, so you'll be able to see that. And again, understand that it's about problem solving. That's what public health is. And we can help a lot of people if we do this well. So this is another key concept and something that I want you to grasp, is public health is multifactorial, right? There's all sorts of things that impact it. You're going to have built environments. Let's say that, and I'll use this as an example. You have people living in poor housing in the inner cities, and they have a rat problem, right? It's been proven that rat feces early on in life, that those kids get exposed to that, it causes there's more asthma, right? So here might have, because of his built environment, it might be a young person or someone that's grown up that's gotten asthma because of their built environment. So that might be something we look at. Um, Biostatistics. Spent a lot of time in 34 years in the business world. We can't manage what we can't measure. I think that's an important concept to understand. If we're just willy-nilly grabbing for things, we've got to measure it, and we've got to use those tools that we have to do that. Social and behavioral sciences. I mean, I may live in a culture where, we eat a lot of spicy and fat and great foods, right? But that social environment is going to impact how what my health is, right? And also the behavioral sciences. We'll look at briefly a book called Change or Die, and what this book says is it really proves it that for the most part, if a doctor tells somebody, listen, if you keep smoking or doing whatever for the next 20 some years, then you're going to die, right? Or even, so I'll give you an example. Someone told someone in my family that smoked all their life, so that if they kept smoking, they would pass within a decade, right? So what we found out from this, though, is that doesn't cause people to change behavior. So we're going to look at not a lot, but we're going to look at ways that have proven more effective to helping people change, right? And this is on an individual level, but I think if we are developing programs and moving stuff forward, it's important to understand that, for example, education alone, we shouldn't go out and feel good about saying, hey, we educated them, we told them they shouldn't eat McDonald's every day, and they did it anyway, so shame on them, right? It's much more complicated than that. It's much more intermingled than that. But that's the thing that makes it exciting. It's fun to be able to solve these problems. These are the 6 key disciplines defined. Like I said earlier, we're going to take next week. We're going to look at epidemiology, right? And I have a hard time saying that. It's, if you figure it out, it's 7 syllables. But if I say it enough, I'll figure it out. So next week we're going to cover in more detail epidemiology. The next week we're going to cover biostatistics. We're going to cover biomedical sciences. And the following week we're going to spend 2 weeks on social and behavioral sciences. I think it's that important, right? If we want people to be healthy, we have to help them, understand that their environments and not just their environments, but their behavior impacts that, right? So environmental sciences, this includes, the air, the water, but also includes built environments, like the example I gave earlier. If a city is not built with sidewalks or parks and places where people can go play, they're less likely to go do those things. So that's something that we'll look deeper into. And then the final thing is health and policy management. We'll look a little bit deeper into each one of these, in the next several weeks, but we're just going to look at them, on a cursory level right now. So epidemiology is the basic science of public health. They're going to ask the who, when, and where questions, right? It's mostly related, and when I say related, but not specifically or exclusively to not chronic, but infectious disease. But it's that's where they're most known for, right? Where they work through those things of the who, when, and where questions. And we'll get into more detail about what that means and look at specific examples as we look through that next week. Again, chain of causation with infectious diseases. You have to have an agent, a host, and an environment. Again, we'll get into more of that as we look at it in more detail next week. Biostatistics. Again, I won't go through each of these points, but at the end of the day, the statistics are what helps us determine probability, right? We'll talk a little bit about the flipping the coin example, right? That if you flip a coin 2 times, you might get 2 heads, or you might get 2 tails. But if you flip it 500 times, there's no way you're going to get 500. So it's a biostatistics helps us, and that it helps us determine probability. Again, remember that there's no absolute in science. That there's you're going to have bias, and that we'll talk about a little bit, right? I mean, selection bias. We all have bias. All these things are going to impact things. But what statistics can do for us is give us things like called confidence intervals and p-values that say, hey, listen, there's not a there either is or is not the theory that this happened by chance, right? So we'll look more deeply into that. Biomedical sciences. If you go and Google today the five or the the disciplines of public health, you're going to find that biomedical sciences is not there. I believe some would say that it belongs. I believe that it belongs, and here's why: is that the biomedical research that is being done in regards to genetics and chronic disease, has to be part of this discipline of public health, because it's going to help drive better outcomes. And so I'm not apologizing for it being here. I'm just saying that if you Google it, you might not find it in other lists of disciplines in public health. So, social and behavioral science assessment, we're going to look at this again in more detail. We're actually taking 2 weeks to look at this. I think it's that important. Um, you know, Behavior is now a leading factor in concern in people's health. Uh, I talked about that book earlier of Change or Die. Um, Education alone is not going to do it, right? We can put all the education out there. There's just so much more confounding influences that might make people be healthy or not healthy. That we want to dig deeper into that and help them figure out how they can change. Environmental health science. This one, there's a little crossover here with built environments, as you can see there at the bottom, but it is the air quality, our water quality, solid and hazardous waste disposal, safe food and drugs. Now, I put a link here under air quality because I think the number is in the 20th century, we added 30 years to life expectancy in the United States, right? So plus 30 years since 1900. It's estimated that 25 of those years are because of the interventions of public health, and a majority of them has been, air and water quality. And so the reason I give you this link here, and you can access it, is that it shows how we have done good things when it comes to air quality. I live in Los Angeles, have lived here since 1990. We used to have smog alerts. They called them like stage 1, stage 2. It was like red, yellow. It's kind of scary, right? You'd drive into work and there'd be these clouds of pollution over there. It's not like that anymore. Thankfully, we have taken some initiative and done things that have improved the quality of the air, where we don't even have those sort of like smog alerts like we used to have. So that's a positive thing, and people are doing positive things in public health, and hopefully this group, and if you decide to get in this area, can continue that trend. So the last is health policy and management. Um, you know, on the healthcare side, even though that is not public health, I mean, they are responsible for things like accessibility of care, cost of care, and quality and delivery of care. And they're responsible for their communities, right? And they need to develop and promote the well-being of those communities. And that's something that is definitely part of public health, even though we often don't say that, hospital systems and health systems are part of that. They absolutely participate and make a contribution to public health. So another key concept is the preventions, and just really understanding this, that primary prevention is something like, if I eat plenty of blueberries, which I do, and I watch my diet, watch my weight, do those things, that's primary prevention, right? That's things that I'm doing now to hopefully prevent bad health incidents down the road. Secondary prevention, it's things like I do have, you know, minor high blood pressure, right? So I get regular checkups to make sure that that's under control. I get, my wife gets breast exams so she can, know that that's being managed. So, and then tertiary prevention. I mean, I've had friends that have passed from cancer. It's not a great thing, but it's to the point where you need surgery, you need radiation, you need things to just stop the flow of things. So these are important things to understand is when you're trying to explain to somebody why they might eat, for example, uh, blueberries to, prevent the need for tertiary prevention 20 years down the road. Now, I'm going to admit to you that it is not in our human psychology so much to say I'm going to make a sacrifice today for something that's going to help me in 30 years. But that is, kind of what we have to manage. Public versus medical care. There's a good summary in a video. One of the videos that's on the main thing that talks about this, what the difference is. Um, the main thing is that public health is more about the community. The medical care is about helping the individual, right? So that's a main difference. Also, what I've quoted to you before was that public health has really driven 25 of the 30 years of additional life expectancy versus the medical care system. So again, I'm pro Western medicine, but certainly we can have as bigger of an impact than the folks in the medical profession. Um, Public health, science, and politics, right? So there's a little bit of, not a little bit, there's plenty of politics in public health. They're going to be involved in the policy development and the assurance functions. They are, certainly our elected representatives are going to play a role in, what gets funded and what doesn't get funded, even though they're philan- uh, philanthropic groups that will support public health. As far as our taxes and that go, I mean, hopefully our representatives, represent us well when they decide how much they should get for certain things. This is something that's not in your textbook, but it's just something that I think is important to understand is that we are just so wonderfully constructed, right? When we're going to take a look, and I'm not sure if it's next week or the following week, we're going to take a look at our immune system. And you're going to see some videos where if you haven't already seen how phenomenal our immune systems are and how wonderfully we're made. And I think this is an important thing to understand because some people look at it, and especially with the COVID, look at themselves as defenseless, right? And just the opposite is true. I mean, God has created us in such a way that we are just awesome and we function just amazingly. And there's just a little bit more information on that. And again, we'll look at that. It might even be in week 4 when we're talking about infectious diseases, how we would look at the immune system. Here's some additional research that you can look at. Again, these will be listed on the module, so you can take a look at those. As you saw in the introduction, one of the things that I want to do is your final project, your 3 or 4 page paper, is to have you take one of the 350 or so core objectives that are tracked by the Healthy People 2000, 2010, 2020, 2030, right? And I want you to go out into not to go out to your communities, but to research where those things are being applied, what organizations are taking the information from the Healthy People Initiative and moving those forward in policy development, in assurance, and all of those things. I think it'll help you tremendously to be able to follow something through the whole assessment, the policy development and assurance process, which again is a key point for understanding here. So this is just the CDC Healthy People Initiative. Take a look at this, read through it. You can find it on the CDC Healthy People Initiative website. But I just think it does a great job of using action words as to what the purpose of their project is. And I do think it's a noble thing. There were some admissions that they had, gotten like kind of their head over their skis, and that there was 350 initiatives in the 2020. and then they scaled it back a little bit because it's just too much to manage. But so yeah, that's something that I think is well worth looking at. I'm not going to spend a lot of time in here other than to say that public health is involved, with the management of public health and terrorism. We all, I shouldn't say we all, I mean, there might be some of you here that were not here in 2001 when the towers got attacked. Again, and I'm not trying to start any conspiracy theories or whatever, but there's some evidence that maybe COVID-19 was in some ways uh, an act of terrorism and bioterrorism, if you will. Um, so that's something that we definitely, as public health officials, want to be aware of. We don't want to bury our heads in the sand and say that no one's ever going to do it, that there's not people in the world that will go to those ends to harm other people. So we're going to touch briefly on this. So what we just covered right there is really the key tenets of public health, and hopefully you'll look at those and we're going to follow those all along. So by the end of this 8 weeks, you should have a clear understanding of epidemiology, how it works in public health, biostatistics, how it works in public health, and on down the line, biomedicine and how that works. So we're just going to touch on briefly why public health is sometimes controversial. And this is another key concept for me because, again, I think if you grapple with the idea of justice, and not that you have to define it one way or the other, and not that there's not a blended idea of justice, but if we just take what the world tells us, or if we go to our scripture and we find out what scripture says about it, but what I want you to do is I want you to look at the ideas of social justice versus market justice, not even versus. I mean, is there a place for both social justice and market justice in our world? The video that you'll watch is part of your one of your discussions this week. One of the discussions you'll have with your classmates will be on the different philosophies of justice. Now, it doesn't just talk about social justice and market justice, although it mentions those. And the reason why I think this is important is because we have to ask ourselves the question: why do we do things? Why is it? Are we working to help other people? Does it have to be fair? Does it have to be just? Right? The short part of justice, right? I mean, does somebody that necessarily works harder and does things deserve a higher level? Is it just the needs of some people that social justice covers? And that's what social justice says. Social justice says that at least the basic needs of everyone should be covered. Market justice is more on, if I voluntarily work harder and I have individual responsibility, and so justice should treat me differently than others. So let's look through that. Let's grapple with that. Let's again, don't. I wouldn't end on continue to evolve with where you're at with that. There's some things that are politically controversial. So let's go to the next slide. So the sources of controversy are economic impact, individual liberties, moral and religious opposition, and political interference with science. We'll look at each one of these just real quickly. So most public health measures may not necessarily help you, but they may help somebody else. So it may be your tax dollars that go to pay for something that you don't directly benefit from, but some others might, right? There again, you're grappling with that, what's fair and what's just. Again, the second point there, those who pay may not be the ones that benefit. The one at top here, businesses often resist public health measures because they affect profits. I can give you several examples. I'll give you one quick example, and I won't name the company, but it's a sugary drink company that sponsors all sorts of research that would tell you that the reason for obesity and that people are getting more obese is because they're not exercising enough. It has nothing to do with any sort of sugary things that they're drinking. So again, there's always going to be that temptation by many to put money over the benefit of individuals. So just be aware of that, right? That's call it a bias, call it what you want, but that's always going to be there. Now, here's something that is a challenge and something we talked about a little bit before is that costs may be short term while benefits may be longer term. So you may not realize a return on your investment for like 20 years down the road, or you may not even realize it because you may have put out some interventions that were meant to prevent something. So when it doesn't happen, nobody notices, right? Um, so yeah, and that's the last thing. There's the same thing. Hard to predict longer term gains when investment is more immediate. Uh, those are tough things to grapple with when something's not right there in front of us. Uh, and I'm not immune to that. It's hard to look longer term. Here's something else that is I think is intertwined with the justice question. Uh, there's a video called "The Tragedy of Commons," and it's something from the British world. But what it talks about is it talks about how um, when there are a certain amount of resources available, how do we divvy them up? And if they're divvied up like to everybody, right? What if somebody takes more than what's their proportion, right? Or is it private property where people understand that if they take too much away from the land, that they will suffer themselves? Where someone that's in the commons might, benefit from being there. So you're going to watch a video, and that's going to be your second discussion question this week. We won't have two discussion questions every week, but I think that this tragedy of commons and this justice, uh, they work together in helping us understand what the right thing to do when it comes to overall public health. So these are just, when can government restrictions restrict individual freedom? They certainly have the right to in situations, like for example, driving under the influence, right? There are laws against it. You can be punished for it. You will be punished for it. So they can restrict that because is and has caused harm to others. Um, Now, there's always the question about whether our government is a paternalistic group and whether they have the right to protect us from our own actions. In some situations, certainly they can it makes sense to do that, or at least to punish people for not doing it. I mean, look at our current system. I mean, it punishes people when they do things wrong, and that is one deterrent, right? That we might uh, inflict in order for them to stop doing that behavior. The libertarian view is that seeks to maximize autonomy, political freedom, and really more individualism, and that government should be smaller, and that the right of the people should be bigger. There's always arguments for restrictions for the common good, and leaves a lot of room for controversy. Now, where might there be controversy? We have a perfect example in front of us right now. My kids, and my youngest is 17, so my other ones are not impacted by this, but my wife is also a second grade school teacher, and they are sending them back in California with masks on. Um, I've done a lot of research on it. I understand what the CDC are using as their justification for sending our kids back with masks. I'm telling you that masks, if they're effective, they're minimally effective. So again, it creates this controversy that you can sense in my voice right here, is that not everybody's going to agree, but I think it's important that we, again, continue to be curious and to continue to speak in facts, and also to have discourse, right? I've had several conversations with my local superintendent, and we've had great dialogue. She tells me where she's coming from. I share with her facts and tell her where I'm coming from. And so that is again, I'm going to continue to encourage you to be curious and to ask questions and understand our own biases, right? Because we all have them. And so that's the way that we help the most people. So moral and religious opposition. I mean, I'm not going to get into a lot of this, but here's one that I'll give that is, um, a lot of people look at it and say that doesn't make sense. In San Francisco, they give fresh needles to drug addicts to help prevent disease. Does it help prevent disease? Yes. Does it help promote continued drug use? Yes. Um, so, people are going to grapple with that, right? Whether it's the right thing to do. Now, I will say this is that um, sometimes opposition is going to keep people from doing research or trying to find out the truth on some things. And I'll give you one example without taking a position on this one way or the other. Is that cannabis is a Schedule 1 drug, right? It's illegal in the states. By being a Schedule 1 drug, it prevents people or prevents uh, getting funding, and so basically scientists don't research it, right? They just were not really sure whether it's helpful or not helpful, medically, et cetera. So that would be one situation where there's people all over the board on cannabis, but that is one area where it's probably helping it or preventing it from getting funding and research. So we may never know unless it doesn't become a non-Schedule 1 drug. Again, I don't have a strong position on that one way or the other. It's just an example of controversy related to how it can, keep from getting funding for certain things. These are discussion questions that we talked about a little bit earlier. That'll show up on your module. So I don't need to spend a lot of time on that. So this is, and we're going to fly through this a little bit, but this is important to understand, but not intricately. You don't have to know this intricately. You'll discover this as you move into, and we'll ask some quiz questions and some midterm questions on this sort of thing. But as far as being a key concept that you have to understand, it's a learning outcome that we'd like for you to know. So you understand, if you've had history classes, that there's a legislative, executive, and judicial branches, right? The federal versus the state. Pretty much today it leans towards the state. There may be some funding from federal government, but most independent decisions are made at the state level, and even further down at the local level, which we'll take a look at right here. So state health departments, they do these different things. Again, I'm not going to spend a lot of time there. Local and public health agencies, these are the people where the rubber meets the road. I have a very good friend who is an attorney for the city of Santa Ana. She works in the program for those kids in the inner city that are, underserved. And so they are the ones that are in the trenches and doing things day to day. So they do the core public health functions. I put a link here for a website. If you look up Orange County Department of Public Health in California, you'll see a PDF here. And the reason I put it here is because you'll see all the many different programs they have. Now, we're a county of like 3 million people, so that's pretty large. But even so, I think even if you look at your own local community, or if you live in a bigger city, you'll see that they provide all sorts of tremendous services for people, and that the public health community is doing some good things there. These are something that, again, will show up on your modules in the online stuff below. There's different links that you can just go to and research how what they're doing in the area of public health. The CDC, very much in the news right now, right, with all of COVID, and by the time you get to this, hopefully, some of that will have passed. But well, no, it's not going to pass because it's a virus and it's going to continue to go. But that said, I mean, the CDC, for the most part, does a pretty good job of managing, providing data, et cetera, on infectious disease, death rates, information there. National Institute of Health also does a fantastic job with all those very things. You can see here that it exists for cancer, heart, lung, and blood, diabetes, aging, child health, human development, and other topics. So another great place to explore how public health helps others. You also have some non-governmental agencies. I think if you heard the expression NGOs, non-governmental agencies, American Cancer Society, the American Heart Association, American Diabetes Association. Now, if you, like me, and you've been on these sites, you'll see sometimes, and I'm not being disparaging of any of these organizations because they do a great job, but you'll see some information that you're like scratching your head a little bit about. And I understand that science is not absolute, science changes, but these organizations also can be influenced by lobbyists, by money, by those things. So again, always be curious, always be critically thinking through information that you're reading, saying, is that really true? I'm going to show you guys, and again, I can't remember which week, but there's a kind of a satire video that talks about uh, things like, it says a guy that comes from the future and he says, eggs are bad for you, right? And then he comes back later and he says, oh no, we decided they're good for you. So again, understanding that there are changes in science, science does change and we discover new things. And that's exciting that we do that. Sometimes though, you look at some of these organizations and you wonder whether they're maybe a little bit behind the times. There are also some great philanthropic foundations. I've gotten a lot from the Robert Wood Foundation. What I mean by that is when I was going through uh, my master's, which is like 15 years ago in public health, they I do lots of research through them and saw a lot of good things from them. Kaiser Foundation, all of these are do some good things in the world.